long line of trailers and motorhomes goes on and on and on, stretching for about a mile. Located just minutes away from some of the wealthiest zip codes in the country, this growing RV encampment has come to symbolize the haves and the have-nots in this.
Homeless RV owners are getting their chance to take their frustrations to court.
They say the city is unfairly ticketing them and forcing them to constantly keep on the move.
Tonight, somewhere in America, a family will fall asleep in a car, not because they failed, but because rent became impossible. The cost of living crisis has turned vehicles into homes for millions of Americans who still work, still pay taxes, and still follow the rules. But the rules changed, and now survival itself is being pushed to the edge. Since 2020, rent in America has risen at a pace that wages simply cannot match. National data shows median asking rents increased roughly 20 to 30% in just 4 years, while real wages after inflation barely moved or even declined for many workers. In practical terms, a $1,200 apartment in 2020 now costs $1,550 to $1,700 in many cities. Meanwhile, the average annual wage increase during that same period was often 2 to 4%, far below rent inflation. Landlords also raised income requirements. Many now require tenants to earn 3 to 3.5 times the rent, meaning a $1,600 apartment demands an income of $57,600 per year. Millions of full-time workers, especially in retail, logistics, healthcare support, and service jobs, do not meet that threshold. Even dual-income households are failing screening algorithms. This disconnect forces people into impossible choices. When rent consumes 45 to 60% of take-home pay, there is no buffer for medical bills, car repairs, or job interruptions. Missing one paycheck is enough to trigger eviction or non-renewal. Once evicted, credit damage makes re-entry into the rental market nearly impossible. Living in a car or RV becomes a financial survival tactic, not a lifestyle choice. It removes rent from the equation while preserving mobility and access to work. This is not a fringe issue. It is the mathematical outcome of housing costs rising faster than income across most of America. The current cost of living crisis is magnified by mass layoffs across multiple industries. Between 2023 and 2025, layoffs in tech, logistics, manufacturing, retail, and transportation totaled well over 1.5 million jobs. Many of these workers were not living paycheck to paycheck by choice, but by necessity due to high housing costs. When someone loses income today, the timeline to homelessness is brutally short. Most Americans have less than 3 months of savings, and in many cases far less. With rents already consuming half of monthly income, a single missed paycheck can cause immediate housing instability. Unemployment benefits often cover only 30 to 50% of prior income and take weeks to process. Landlords rarely wait. Non-payment notices go out within days, and lease non-renewals follow quickly. Unlike past recessions, downsizing is no longer an option. Cheaper apartments no longer exist in many metro areas. Waiting lists for subsidized housing stretch months or years, not weeks. At that point, vehicles become emergency housing. People sleep in cars, vans, and RVs while trying to stabilize income, attend interviews, or keep existing jobs. Vehicle living allows someone to stay near employment centers instead of being forced into distant shelters or overcrowded shared housing. This is why vehicle homelessness is growing among people who were recently employed. It is not driven by addiction or long-term poverty. It is driven by layoffs colliding with an unaffordable housing market that offers no second chances. Even when people find an apartment they can theoretically afford, move-in costs have become an insurmountable barrier. In many U.S. cities, renters must now provide first month's rent, last month's rent, and a security deposit, sometimes equal to another full month. For a modest $1,600 unit, that means $4,800 up front. In higher cost areas, upfront costs routinely exceed $7,000 to $9,000. For households already struggling with inflation, this money simply does not exist. Grocery prices are up 20 to 25% since 2020. Auto insurance premiums have surged, and credit card interest rates often exceed 25% APR. Using credit to secure housing only delays collapse and increases long-term debt. Even assistance programs are overwhelmed. Emergency rental assistance funds dry up quickly, and eligibility rules exclude many working households who earn too much on paper but still cannot save thousands of dollars. Charities rarely cover full move-in costs, leaving people trapped. Vehicle living removes this upfront barrier. A paid-off car or used RV requires no deposit, no credit check, and no proof of income. Fuel and maintenance costs are predictable compared to sudden rent hikes or lease termination fees. This shift is structural. Housing is no longer gated by monthly affordability alone. It is gated by access to large sums of cash up front. For millions of Americans, that gate is permanently closed, making vehicles the only immediately accessible form of shelter. For many Americans, a vehicle is the final asset left after housing becomes unaffordable. When rent consumes income and savings are depleted, selling the car is not an option. It is the only thing enabling survival. Without a vehicle, people lose access to work, healthcare, food, and basic safety. A paid-off car or RV represents mobility, shelter, and independence combined. Even a financed vehicle often has lower monthly costs than rent. A $450 car payment plus fuel is still cheaper than a $1,700 apartment with utilities. This math is forcing people to repurpose vehicles as living spaces. RVs, vans, and SUVs are especially appealing because they provide insulation, storage, and privacy. Older RVs can be purchased for $5,000 to $15,000, far less than the cash required to move into an apartment. For families or seniors, RVs offer space that cars cannot. However, this strategy is fragile. Repairs, breakdowns, and mechanical failures instantly threaten housing stability. There is no landlord to call, no maintenance coverage, and no safety net. One transmission failure can erase a person's home overnight. Still, millions are making this choice because the alternative is worse. Vehicles are not becoming homes because people want them to be, but because the traditional housing system has priced vast segments of the population out entirely. When your car becomes your last line of defense against complete homelessness, you hold onto it no matter what. Living in a car or RV is often portrayed as cheap, but rising costs are rapidly eroding that assumption. Auto insurance premiums have increased 20 to 25% nationwide, with some states seeing even higher spikes. Registration fees, emissions requirements, and inspection costs add hundreds more per year. Fuel prices remain volatile, and vehicle dwellers rely on constant movement to avoid enforcement. That increases fuel consumption significantly. A person sleeping in an RV may spend $300 to $600 per month just to relocate and avoid parking citations. Repairs, oil changes, and wear accumulate faster when vehicles are used as homes. Parking has also become a financial risk. Overnight bans, permit systems, and enforcement zones mean tickets can stack up quickly. Multiple citations often lead to towing. A single tow can cost $1,500 to $4,000 in fees, storage, and release charges. Money most vehicle dwellers do not have. Once a vehicle is impounded, the crisis escalates. Without shelter or transportation, people lose jobs, miss court dates, and fall deeper into poverty. This is how vehicle living turns from a temporary solution into a long-term trap. What began as a cost-saving survival tactic is becoming increasingly expensive and dangerous. As cities tighten enforcement and costs rise, millions of Americans are discovering that even living in a vehicle is no longer affordable. But they have nowhere else to go. Across the United States, cities are responding to visible vehicle living not with housing solutions, but with enforcement. Since 2022, hundreds of municipalities have passed or expanded overnight parking bans, RV-specific ordinances, size limits, and time restrictions. These laws are often framed as traffic or sanitation rules, but their practical effect is to make sleeping in a vehicle illegal. Many ordinances limit parking to 2 to 4 hours, prohibit habitation, or ban oversized vehicles entirely. Others require permits that are capped or impossible to obtain without proof of residence, something vehicle dwellers do not have. Enforcement typically occurs overnight or before sunrise, when people are asleep and least able to relocate safely. Cities justify these actions by citing complaints, sanitation concerns, or emergency access. However, most provide no alternative shelter, and existing shelters are frequently full or incompatible with families, pets, or people who work overnight shifts. This creates a cycle of displacement. Vehicle dwellers are forced to move nightly, burning fuel, missing sleep, and risking citations. Each move increases stress and decreases the ability to maintain employment. What was once a temporary survival strategy becomes a constant state of legal vulnerability. Criminalization does not reduce homelessness, it hides it. people are pushed into industrial zones, unsafe areas, or constant motion. The result is not cleaner cities, but a population living under continuous threat of tickets, towing, or arrest simply for existing without a lease. Towing is the most devastating enforcement tool cities use against vehicle dwellers. One citation can escalate quickly into impoundment, especially when multiple parking violations stack up. The financial impact is immediate and catastrophic. Average tow and impound fees range from $1,500 to over $4,000, depending on city, vehicle size, and storage duration. For someone living in their vehicle, impoundment is not just a fine. It is the loss of their home, transportation, documents, medication, and personal belongings all at once. Many impound lots charge daily storage fees, making retrieval impossible after just a few days. Without a vehicle, people miss work, lose income, and cannot attend court dates or job interviews. This often results in additional penalties, warrants, or job termination. The cascade happens fast. What started as a parking violation becomes full-scale homelessness within days. Cities claim towing is a last resort, but data shows it is increasingly common. In some West Coast cities, vehicle-related tows increased by 30 to 50% after new enforcement rules were introduced. RVs are especially targeted due to size and visibility. Once a vehicle is lost, recovery is rare. Few people can raise thousands of dollars on short notice. Many vehicles are eventually auctioned, permanently severing a person's path back to stability. Towing does not solve homelessness. It locks it in permanently. One of the most misunderstood aspects of vehicle homelessness is employment. A significant portion of people living in cars and RVs are working full-time or part-time jobs. Studies and school district reports show that 40 to 60% of unhoused adults in some regions are employed, often in essential roles. These individuals work in warehouses, hospitals, retail stores, restaurants, construction sites, and transportation hubs. They wake up in parking lots, industrial zones, or roadside areas, then clock in like everyone else. The difference is that they have no address to go home to. Living in a vehicle allows proximity to work, which shelters often do not. Shelters may require nightly check-ins, restrict hours, or be located far from job centers. For people working early mornings, late nights, or rotating shifts, shelters are not functional options. However, the lack of an IHE address creates systemic barriers. Employers require mailing addresses, insurance companies demand residency, and banks flag accounts. Simple tasks like renewing licenses, receiving prescriptions, or enrolling children in school become complex. This population is largely invisible in official statistics because they do not fit traditional definitions of homelessness. They are not sleeping on sidewalks. They are sleeping in vehicles after work. That invisibility allows the crisis to grow unchecked, even as millions of working Americans quietly lose housing stability every year. Older Americans are increasingly represented among vehicle dwellers. Fixed incomes from Social Security average roughly $1,900 per month, while average rents in many regions now exceed $1,600 to $2,000. This leaves little to nothing for food, healthcare, or transportation. Many seniors are priced out after rent increases, medical expenses, or the death of a spouse. Once displaced, re-entering the rental market is nearly impossible due to income screening requirements and limited senior housing availability. Waiting lists for subsidized senior housing often exceed 2 to 5 years. RVs and vehicles become a last resort. Older RVs offer insulation, space, and familiarity, but they also require maintenance, fuel, and physical ability to manage repairs. Seniors face higher risks of heat exposure, cold stress, and medical emergencies while living in vehicles. Healthcare access becomes critical. Missed medications, delayed treatments, and lack of refrigeration for insulin or other drugs increase hospitalization rates. Emergency rooms become the primary point of care, raising public healthcare costs. This is not a fringe trend. Social service agencies report sharp increases in seniors seeking help for vehicle living situations. The idea that retirement guarantees stability is collapsing. For many older Americans, the final chapter of life is being spent in parking lots, not by choice, but by economic force. The promise of secure retirement has become a memory for millions. Cold weather exposes the deadly limits of vehicle living. During winter months, vehicle dwellers face hypothermia, carbon monoxide poisoning, and fire risks. Running engines for heat increases fuel costs and creates carbon monoxide hazards. Using propane heaters or improvised heating devices raises fire risk. Cold-related deaths among unhoused populations spike each winter. In some regions, winter exposure deaths increased by 20 to 40% during severe cold seasons. Vehicles offer minimal insulation, especially older cars and RVs not designed for sub-freezing temperatures. Fuel costs rise sharply as people idle engines overnight. A single cold night can burn several gallons of fuel, making survival increasingly expensive. Mechanical failures are also more common in winter, and a dead battery or frozen engine can instantly eliminate shelter. Cities often increase enforcement during winter due to emergency declarations or snow removal rules, forcing people to move in dangerous conditions. Shelters may be full, inaccessible, or unsafe for families and seniors. Winter exposes the truth of the crisis. Vehicle living is not sustainable, safe, or humane, yet millions are forced into it because the housing system has no place for them. Cold weather does not create the crisis. It reveals it, often with fatal consequences. Every winter, more people die in vehicles that were never meant to be homes, victims of an economic system that has left them nowhere else to turn. One of the least visible consequences of the cost of living crisis is the rise in families living in cars and RVs. School districts across the country report growing numbers of students classified as housing insecure, meaning they sleep in vehicles, motels, or temporary setups. Federal education data already counted over 1.3 million homeless students, and vehicle living is one of the fastest-growing subcategories. Parents keep this hidden out of fear of child protective services, school stigma, or losing custody. Children attend school during the day, complete homework, and participate in activities, while nights are spent in parking lots or moving locations to avoid enforcement. Vehicles provide privacy that shelters often cannot, especially for families with multiple children. Financially, families are hit hardest by upfront housing barriers. Even when parents are working, saving $6,000 to $10,000 for deposits is unrealistic when food, childcare, and transportation costs are already elevated. Motel living is often worse, costing $2,500 to $4,000 per month, pushing families back into vehicles. Children living in vehicles face higher absenteeism, sleep deprivation, and stress-related health issues. Yet many remain invisible because they are not sleeping on sidewalks. Vehicle living allows families to function temporarily, but it delays access to long-term help. This is not a failure of parenting. It is a failure of affordability. RV parks were once considered a low-cost alternative to traditional housing. That has changed rapidly. Monthly RV park rates now commonly range from $900 to $1,500, with premium locations exceeding $2,000 per month. These prices rival apartment rents, but offer none of the legal protections tenants receive. Many parks require background checks, long-term commitments, and proof of income, criteria that exclude people already displaced. Others restrict older RVs, limit stay lengths, or ban full-time residency altogether. As demand rises, availability shrinks, utility costs add further pressure. Electricity, propane, water, and sewer fees often push total monthly RV living costs well beyond expectations. Combined with insurance, fuel, and maintenance, RV living can exceed $2,000 per month, making it unsustainable for low-income households. As RV parks transition toward short-term tourism models, displaced residents are pushed back onto streets and parking lots. This removes one of the last semi-stable housing alternatives available to people priced out of apartments. The result is a bottleneck: too expensive for parks, illegal on streets, and inaccessible shelters. RV parks are no longer absorbing housing pressure. They are reflecting it. What was once a safety valve is now another closed door, leaving vehicle dwellers with fewer options every month as prices climb and restrictions multiply across the country. Legal shifts have accelerated enforcement against vehicle dwellers. Recent court decisions clarified that cities may enforce camping and parking bans even when shelter capacity is limited. While rulings vary by jurisdiction, the practical effect has been a green light for aggressive enforcement. Cities interpreted these decisions as permission to clear vehicles, issue citations, and tow without providing alternatives. Enforcement budgets increased, and police departments were instructed to resume sweeps that had paused during earlier legal uncertainty. For vehicle dwellers, this removed the last layer of protection. Previously, many relied on legal ambiguity to remain in place temporarily. Now, enforcement is more consistent and less restrained. Citations escalate faster, and tolerance windows have narrowed. This shift disproportionately affects those using vehicles as their only shelter. Unlike tent encampments, vehicles are easy to target and remove. A single tow eliminates both housing and transportation, making recovery far more difficult. The legal system did not create homelessness, but it reshaped how visible and survivable it is. With enforcement expanding and housing still inaccessible, courts have indirectly accelerated displacement without addressing root causes. The message is clear: living in a vehicle is now more dangerous and less tolerated than ever before. The window for survival is closing, and millions of Americans are being pushed into an impossible position with no legal recourse and nowhere to go. Enforcement is rising while solutions remain absent. Living in a vehicle under threat of enforcement creates extreme psychological stress. Constant movement disrupts sleep, routines, and emotional stability. People report chronic anxiety, hypervigilance, and exhaustion from scanning for police, security, or complaints. Sleep deprivation alone has severe consequences. Irregular rest impacts decision-making, job performance, and physical health. Over time, this leads to depression, irritability, and emotional shutdown. For families and seniors, the effects are compounded. Mental health services are largely inaccessible without stable housing. Missed appointments, lack of transportation after towing, and inability to store medications worsen conditions. Crisis episodes increase, but treatment options decrease. This environment turns temporary hardship into long-term trauma. People are not failing to cope. The system is forcing instability. When survival requires constant relocation, long-term planning becomes impossible. Mental health decline is not a side effect of vehicle living. It is a predictable outcome of enforced instability. The longer displacement continues, the harder it becomes for people to re-enter stable housing, even if financial conditions improve. The psychological toll is invisible but devastating. People who were once stable, employed, and mentally healthy are being ground down by a system that criminalizes poverty and offers no path forward. The damage being done to millions of Americans will echo for years, even if housing suddenly became affordable tomorrow. Trauma does not heal quickly. Vehicle living is no longer confined to high-cost coastal cities. Midwestern, southern, and mountain states are now seeing rapid increases as rents rise and wages stagnate. States once considered affordable now face the same affordability gaps. Insurance hikes, property tax increases, and housing shortages are spreading nationally. As people relocate seeking cheaper living, demand rises in new regions, driving prices up again. This creates a rolling affordability crisis with no relief zone. Rural areas offer fewer services, fewer jobs, and fewer shelters. Vehicle dwellers in these regions face isolation, limited healthcare access, and harsher weather conditions. Enforcement may be less visible, but resources are also scarcer. The narrative that people can just move somewhere cheaper no longer holds. The crisis is systemic, not regional. It follows wage structures, not geography. Vehicle living is becoming a nationwide indicator of economic stress, not a localized anomaly. When cars become homes across all regions, it signals a structural failure, not a temporary imbalance. What started in California and Oregon is now showing up in Oklahoma, Tennessee, Arizona, and Montana. Small towns that never had visible homelessness are now seeing RVs parked permanently on side streets. The American housing crisis is no longer coastal. It is everywhere, and it is getting worse in places with the fewest resources to respond. This is a national emergency in slow motion. All indicators suggest vehicle homelessness will continue rising. Interest rates remain elevated, limiting new housing construction. Insurance premiums, property taxes, and municipal enforcement budgets are increasing. Meanwhile, wages remain flat relative to living costs. New zoning restrictions, RV bans, and parking enforcement plans are already scheduled for rollout in many cities. As legal clarity increases, tolerance decreases. The window for informal survival strategies is closing. At the same time, safety nets are shrinking. Emergency rental assistance funds are depleted, shelters are overcrowded, and affordable housing pipelines are years behind demand. Millions are one financial shock away from displacement. Vehicle living is not a solution. It is a warning signal. When cars and RVs become default housing, it means traditional systems have failed to absorb economic pressure. Without structural changes, this crisis will not stabilize. It will compound. More enforcement, fewer options, and rising costs create a feedback loop that pushes more Americans into vehicles each year. What is happening now is not the peak. It is the beginning of a larger displacement cycle already in motion. The next 2 years will see millions more Americans forced into vehicles, not because they made bad choices, but because the system has run out of room for them. The trajectory is clear, the warnings are everywhere, and nothing is being done to stop it. This isn't rock bottom. This is the moment before things get much worse.
Baby boomers are aging, and now there's an alarming new study about the so-called silver tsunami. It finds more and more people over the age of 50 are ending up homeless.
Over 800,000 Americans now live in RVs because they have nowhere else to go, and a growing share of them are seniors. As housing collapses and enforcement tightens, elderly Americans are being pushed out, moved along, and quietly erased from the system. Adults aged 55 and older represent the fastest-growing segment of America's homeless population. Federal data shows over 20% of unsheltered people are seniors, though researchers believe the actual number is much higher due to widespread undercounting. Many older adults avoid traditional shelters and instead live in vehicles or RVs, making them invisible in official statistics. Housing policy analysts project that senior homelessness will triple by 2030 if current trends continue unchecked. The median age of homeless individuals has shifted dramatically. In 1990, it was 35 years old. Today, it exceeds 50. This change reflects an entire generation aging into homelessness after experiencing decades of wage stagnation, skyrocketing housing costs, and minimal retirement savings. Nearly 50% of Americans over 55 have zero retirement savings, while Social Security provides only about $1,900 monthly on average, far below median rent across most states. Medical expenses accelerate financial decline. Adults over 65 spend 3 times more on health care than working-age adults, even with Medicare coverage. A single hospitalization can eliminate remaining savings and trigger eviction. Once homeless, seniors struggle to secure new housing due to fixed incomes, mobility limitations, and extremely long waiting lists. In many metropolitan areas, Section 8 housing voucher waitlists stretch 5 to 10 years, effectively excluding seniors from assistance. This isn't a temporary spike in homelessness. It's a fundamental demographic shift. The aging baby boomer generation combined with severe housing scarcity is structurally increasing senior homelessness every year. Most homeless seniors didn't experience lifelong poverty. They became homeless when a single financial emergency collided with a fixed income. Social Security replaces only about 40% of pre-retirement income, while housing costs have increased over 60% since 2000. This mismatch creates impossible financial mathematics. Housing experts define cost-burdened as spending more than 30% of income on housing. Most seniors now spend 50 to 70%, leaving insufficient funds for food, medication, or utilities. Property taxes and insurance make matters worse. Seniors who once owned homes outright face displacement from tax increases, homeowner association fee hikes, or insurance cancellations, especially in states experiencing climate-related risks. Reverse mortgages may delay foreclosure, but eliminate equity safety nets. Once sold or foreclosed, re-entering the rental market becomes nearly impossible. Inflation compounds everything. Between 2021 and 2024, food prices rose over 25%, while Social Security cost of living adjustments lagged behind real senior expenses. Prescription costs regularly exceed $300 to $600 monthly for chronic conditions, even with Medicare Part D coverage. This isn't financial mismanagement, it's arithmetic failure. Fixed incomes cannot absorb variable costs. When rent increases faster than benefits, homelessness becomes mathematically inevitable, not from poor behavior, but from impossible economics. Seniors aren't failing to budget properly. The system itself has become unaffordable for people living on retirement income designed for an economy that no longer exists. For many seniors, an RV isn't a lifestyle choice. It's the final barrier between shelter and sleeping on sidewalks. Used RV prices surged during the housing crisis, but they remain cheaper than rent in many regions. Seniors often liquidate remaining savings to purchase $8,000 to $25,000 RVs, believing they can survive on parking fees, fuel, and minimal utilities. However, RV living introduces dangerous new risks. Mechanical failure can instantly render a senior completely homeless overnight. Unlike apartments, RVs offer zero legal tenant protections. A single tow notice can erase someone's entire living space. Existing health conditions make RV survival particularly dangerous. Seniors face higher risk of hypothermia below 50 degrees Celsius and heat stroke above 90 degrees Celsius, both common inside poorly insulated vehicles. Carbon monoxide poisoning from heaters and generators is a recurring cause of death. Many seniors lack access to electricity for critical medical devices like oxygen concentrators or CPAP machines. Sanitation creates another major hazard. Without dump station access or running water, infections and dehydration become commonplace. Emergency responders report that seniors living in vehicles are twice as likely to die during extreme weather events compared to housed seniors. The RV isn't providing safety. It's merely delaying the inevitable. Once the RV is lost, broken down, or towed away, seniors transition immediately to sidewalk homelessness, where mortality rates spike dramatically within the first year of street living. Official homelessness counts drastically understate senior suffering because they fail to capture vehicle dwellers, couch surfers, and informal RV communities. Point-in-time counts occur once yearly, often during winter, and rely on visual identification. Seniors in RVs parked legally or semi-legally are excluded entirely from these counts. Researchers estimate that for every visibly homeless senior counted, there are 2 to 3 more living in vehicles or temporary arrangements. This hidden population avoids shelters due to safety concerns, mobility issues, or lack of medical accommodations. Consequently, their deaths are rarely recorded as homelessness-related. Medical examiners typically list causes such as heart failure, dehydration, or infection, without noting housing status. This obscures systemic responsibility. Studies comparing housed and unhoused seniors show mortality rates 3 to 5 times higher among the homeless, with average life expectancy reduced by 10 to 15 years. Isolation proves lethal. Seniors without family or community support often die unnoticed. First responders routinely discover deceased individuals in vehicles days or weeks after death. These deaths rarely make headlines and are excluded from policy debates. Because they remain unseen, resources are misallocated. Cities design programs based on flawed counts, underfunding senior-specific housing and medical outreach. The crisis appears smaller than reality, allowing it to grow unchecked. Hidden homelessness isn't a statistical error. It's a deadly blind spot that quietly increases senior deaths every year, while policymakers remain unaware of the crisis's true scale. Across America, cities are enforcing stricter bans on vehicle dwelling, overnight parking, and RV habitation. These policies disproportionately affect seniors who cannot relocate easily or comply with constant movement orders. Enforcement is framed as public safety but operates as mobile eviction. Each tow costs $1,000 to $3,000, far beyond senior financial means. Once towed, RVs are often destroyed or auctioned within weeks. Seniors lose not only shelter, but medications, documents, mobility aids, and personal records. Recovery becomes impossible. Frequent displacement worsens health outcomes significantly. Medical studies show that forced moves increase hospitalization rates by 40 to 60% among older adults. Disrupted medication schedules lead to strokes, heart attacks, and diabetic crises. Missed medical appointments result in lost benefits and disrupted care continuity. Cities argue enforcement encourages shelter use, but shelter capacity remains insufficient. Many shelters refuse individuals with medical needs, pets, or mobility devices. Seniors are often turned away or forced into unsafe congregate environments where infection risk runs high. Data from municipalities shows that enforcement doesn't reduce homelessness, it increases churn. Seniors are pushed farther from services, farther from clinics, and deeper into isolation. Mortality rises while visible homelessness temporarily declines from public view. This isn't neutral policy. It actively converts precarious survival into fatal exposure, especially for seniors whose aging bodies cannot withstand constant displacement. Cities are essentially criminalizing the act of being elderly and homeless simultaneously. America's safety net wasn't designed for mass senior homelessness. Social Security, Medicare, and housing assistance function independently, leaving critical gaps. Housing vouchers reach only 1 in 4 eligible seniors due to funding limitations. The rest wait years, often dying before assistance arrives. Medicare covers medical treatment but not housing, utilities, or long-term care coordination. Medicaid eligibility varies by state, leaving many seniors uninsured or underinsured. Navigating applications requires internet access, documentation, and cognitive capacity, barriers many homeless seniors cannot overcome. Shelters are mismatched to senior needs. Most lack medical staff, refrigeration for medications, or ADA-compliant facilities. Congregate shelters increase exposure to influenza, COVID-19, and pneumonia, leading causes of death among homeless seniors. Federal affordable housing construction has declined dramatically. America builds less than half the housing units needed annually, while senior demand continues rising. Meanwhile, nursing homes require asset depletion, forcing seniors to become officially poor before receiving care. The result is a system that responds after collapse, not before. By the time seniors qualify for help, they are already medically fragile and housing excluded. This isn't individual failure, it's systemic design failure, one that converts aging into homelessness and homelessness into early death. The programs that exist were built for different demographics and different economic conditions. They cannot address today's crisis of seniors aging into street homelessness at unprecedented rates. Climate extremes have become a major driver of senior deaths among the unhoused. Older adults are physiologically less able to regulate body temperature, making heat waves and cold snaps especially lethal. Medical data shows adults over 65 are 4 times more likely to die during heat events than younger populations. RVs provide minimal insulation. Interior temperatures can exceed 120 degrees in summer and drop near freezing during winter. Seniors living in vehicles lack consistent access to air conditioning, heating, or power hookups. Running generators increases carbon monoxide risk, while idling engines consume fuel seniors often cannot afford. Between 2020 and 2024, heat-related deaths in America rose by over 50%, with disproportionate numbers involving older adults without stable housing. Cold exposure is equally deadly. Hypothermia can occur indoors at temperatures as high as 50 to 60 degrees, especially for seniors with low body fat or circulation issues. Emergency cooling and warming centers exist, but enforcement policies often force seniors to move away from urban areas where these services are located. Transportation barriers, mobility impairments, and fear of losing their RV prevent many from accessing help. Weather is no longer an occasional risk, it's constant pressure. Each heat wave, wildfire evacuation, flood, or winter storm compounds physical stress. For seniors living in RVs, extreme weather shortens survival timelines dramatically, turning temporary shelter into a recurring medical emergency that many bodies simply cannot endure repeatedly. Most homeless seniors are medically fragile before losing housing. Over 70% have at least one chronic illness, such as heart disease, diabetes, COPD, or kidney failure. Stable housing is a critical component of managing these conditions. Without it, health declines accelerate rapidly. Medication storage becomes impossible. Insulin, inhalers, and heart medications require temperature control. Missed doses can trigger hospitalization within days. Seniors experiencing homelessness are 3 times more likely to visit emergency rooms, yet far less likely to receive follow-up care. Mobility limitations compound the problem significantly. Many seniors rely on walkers, wheelchairs, or prosthetics. Uneven terrain, lack of bathrooms, and forced vehicle relocation increase fall risk. Falls are the leading cause of injury-related death for adults over 65. Mental health deteriorates as well. Cognitive decline, depression, and anxiety worsen under chronic stress. Studies show dementia symptoms accelerate significantly in homeless environments. Once cognitive function declines, navigating benefits, appointments, and compliance becomes nearly impossible. Healthcare systems aren't structured for this reality. Clinics discharge seniors back to vehicles after treatment, creating a revolving door. Without housing, recovery fails repeatedly. Medical fragility doesn't cause homelessness. Homelessness magnifies fragility until survival becomes unlikely. The combination of chronic illness and unstable housing creates a downward spiral. Each health crisis makes housing harder to maintain, and each housing disruption worsens health conditions. This cycle accelerates until seniors become too sick to recover. Loneliness isn't just emotional, it's medically lethal. Seniors experiencing homelessness often lack family, partners, or community connections. Social isolation increases mortality risk by up to 30%, comparable to smoking or obesity as a health hazard. RV-dwelling seniors are frequently invisible. They avoid attention to prevent citations or harassment. This isolation means fewer welfare checks, fewer emergency interventions, and delayed discovery when health crises occur. Many deaths are completely unwitnessed. Isolation also blocks advocacy. Seniors without social networks struggle to navigate bureaucracy. Missed mail, expired identification, and lost phones can sever access to benefits entirely. Once disconnected, re-entry is rare. Research shows seniors with consistent social contact are far more likely to survive homelessness and transition back to housing. Without it, decline accelerates. Isolation becomes cumulative. Each day without contact increases risk exponentially. In this crisis, deaths aren't always sudden. They're gradual disappearances, people slipping through systems with no one left to notice their absence. The elderly man who dies in his RV in a Walmart parking lot may go undiscovered for weeks. The woman who stops showing up at the food bank simply vanishes from community awareness. Without social ties, there's no one to sound the alarm when someone needs help, and no one to mourn when they're gone. Social isolation transforms homelessness from a housing crisis into a death sentence. Once concentrated on the West Coast, senior RV homelessness is now expanding into the Midwest, South, and Northeast. Rising rents, insurance withdrawals, and property taxes are pushing seniors out of housing in states previously considered affordable. States like Arizona, Texas, Florida, Tennessee, and Ohio report rapid growth in vehicle homelessness among older adults. Warmer climates attract displaced seniors seeking survivable conditions, creating overcrowding and stricter enforcement responses. Rural areas are not immune. Seniors pushed out of cities migrate to smaller towns lacking services, hospitals, or housing programs. Emergency response times increase, and mortality rises accordingly. This is no longer a regional issue. It's a national pattern driven by housing scarcity and aging demographics. As the population over 65 grows by millions each year, pressure will intensify across all regions. The geography of senior homelessness is shifting rapidly. Communities that never dealt with visible RV encampments are now seeing dozens or hundreds of seniors parking in commercial areas, rest stops, and public lands. Local governments lack experience managing this crisis and often respond with enforcement rather than services. Even traditionally affordable states are becoming unaffordable for seniors on fixed incomes. The problem is metastasizing outward from expensive coastal cities into America's heartland. No community is prepared for the scale of what's coming. As more seniors lose housing, RVs will become even more common as emergency shelter nationwide. Allowing seniors to die while homeless is not only a moral failure, it's economically irrational. Emergency medical care for unhoused seniors costs far more than housing interventions. One hospitalization can exceed $20,000, while supportive housing costs less annually. Studies show that providing stable housing to medically vulnerable seniors reduces healthcare spending by up to 40%. Yet funding remains fragmented and reactive rather than preventive. Every senior death represents preventable loss. These are people who worked, paid taxes, raised families, and contributed to society for decades. Their deaths aren't inevitable. They're policy outcomes resulting from choices about resource allocation. Without intervention, senior homelessness will continue rising and street deaths will increase proportionally. The cost will be paid in lives, strained hospitals, and moral credibility as a nation. This crisis is not coming. It's already here, claiming lives daily across America. The economic argument alone should compel action. Society pays for senior homelessness one way or another, either through preventive housing or through expensive emergency interventions, hospitalizations, and premature deaths. The current approach is the most expensive option while producing the worst outcomes. Beyond economics, there's a fundamental question about what kind of society allows its elderly to freeze, overheat, or die from treatable conditions in parking lots after lifetimes of work and contribution. Inaction is a choice with consequences measured in human lives. Emergency shelters are often presented as the solution, but for seniors, they frequently increase risk instead of reducing it. Most shelters are designed for short-term, able-bodied adults, not elderly individuals with chronic illnesses, mobility limitations, or medical equipment. Many shelters lack ADA-compliant bathrooms, lower bunks, or quiet medical spaces, making them unsafe for seniors. Rules also exclude large numbers of older adults. Curfews conflict with medical schedules. Pets, often a senior's only companion, are banned. Couples are separated. Medical oxygen, mobility scooters, or refrigerated medications are frequently prohibited due to liability concerns. Congregate shelters significantly raise infection risk. Seniors are far more vulnerable to influenza, pneumonia, COVID-19, and norovirus, all of which spread rapidly in crowded indoor environments. During outbreaks, seniors are often advised by doctors to avoid shelters entirely, leaving RVs or streets as the only option. Length of stay is another problem. Shelters typically limit stays to 30 to 90 days, far shorter than the years-long wait for affordable housing. Seniors cycle back to homelessness repeatedly, each time weaker than before. For many older adults, shelters aren't refuge. They're a last resort, actively avoided. When policymakers count shelter beds as solutions, they ignore the medical reality facing aging bodies. Shelters solve homelessness for some populations, but often fail seniors entirely. Accessing assistance requires navigating complex systems that assume digital access, cognitive clarity, and physical stability, conditions many homeless seniors lack. Applications for housing, healthcare, and benefits often require online portals, scanned documents, and repeated verification steps. Lost identification is catastrophic. Without ID, seniors cannot access Social Security, Medicare, or housing programs. Replacing documents can take months, during which benefits are frozen. Mailing addresses are required, yet many seniors living in RVs lack stable mail access. Cognitive decline worsens the barrier significantly. Mild dementia or memory loss, common after age 65, makes it difficult to track appointments, deadlines, or paperwork. Missed steps result in automatic disqualification from programs. Caseworkers are overloaded. In many cities, one worker manages 50 to 100 clients, making personalized senior support impossible. Follow-ups fall through, applications expire, and seniors drop out of the system silently. The system doesn't adapt to seniors. It waits for perfect compliance. Those who cannot keep up are labeled non-compliant rather than vulnerable. Bureaucracy becomes a filter, helping only those strong enough to navigate it, while excluding those most at risk of dying. Instead of meeting seniors where they are, systems demand seniors meet impossible standards. The most vulnerable, those with cognitive decline, lost documents, or no internet access, are systematically screened out. The people who most desperately need help are the least able to access it. Older women represent a rapidly growing share of the homeless senior population. They typically earn less over a lifetime, receive smaller Social Security checks, and live longer, stretching limited resources further. Widowhood is a major trigger. After a spouse's death, household income can drop by 30 to 50% overnight. Women are also more likely to have interrupted work histories due to caregiving responsibilities, reducing retirement savings significantly. Nearly 2/3 of elderly women rely on Social Security for the majority of their income. Homelessness is especially dangerous for women. Risk of assault, theft, and exploitation is significantly higher. Many women choose RVs or vehicles specifically to avoid shelters where abuse is common. This keeps them hidden and uncounted in official statistics. Health consequences escalate quickly for homeless women. Osteoporosis, arthritis, and autoimmune disorders are more prevalent in older women, making cold exposure and falls more dangerous. Limited access to gynecological care compounds health risks. As rents rise, elderly women are being displaced at accelerating rates. This isn't a fringe issue. It's a gendered crisis unfolding quietly, with women aging into homelessness faster than housing systems can respond. The feminization of senior homelessness reflects lifetime economic inequalities compounded by aging. Women who earned less, saved less, and face higher healthcare costs are disproportionately vulnerable when housing becomes unaffordable. Their crisis often remains invisible until it becomes fatal. Senior homelessness doesn't occur in isolation. It destabilizes families, healthcare systems, and entire communities. Adult children often lack the space or income to absorb aging parents, especially amid high housing costs and multi-generation crowding pressures. When seniors lose housing, responsibility shifts to emergency services. Ambulance calls, emergency room visits, and hospital stays surge dramatically. Hospitals become de facto shelters, discharging patients back to the street once medically stabilized. Communities absorb the cost through strained public services, increased policing, and overwhelmed clinics. Meanwhile, younger generations watch the collapse of the retirement promise in real time, eroding trust in institutions and future planning. The message is clear. Working your entire life no longer guarantees safety in old age. This perception changes behavior across generations, increasing financial fear, hoarding, and disengagement from long-term planning. Senior homelessness isn't just a crisis of today's elderly. It's a warning signal to everyone behind them in the age pipeline. When younger people watch their parents or grandparents become homeless after decades of work, it fundamentally changes their understanding of social contracts. The promise that hard work and saving lead to secure retirement has been broken. This creates ripple effects through family structures, community stability, and generational trust. The crisis of today's seniors becomes tomorrow's widespread social instability as trust collapses. Without intervention, senior homelessness will accelerate sharply through the late 2020s. The population over 65 is expanding faster than housing supply, while affordability continues eroding. Each year, more seniors will cross the threshold from housed to unhoused. Deaths will rise quietly through exposure, untreated illness, and isolation. These deaths will remain underreported, categorized as natural causes rather than systemic failure. RV living will become less viable as enforcement tightens and parking disappears. Seniors will lose their last buffer and transition directly to street homelessness, where survival timelines shorten dramatically. This trajectory isn't hypothetical. It's already unfolding across America. The only variable is scale and speed. Without structural change, aging in America will increasingly mean aging without shelter and dying without notice or intervention. The next decade will determine whether senior homelessness becomes normalized or addressed. Current trends point toward normalization. As more seniors lose housing, society may simply adjust expectations downward, accepting that a certain percentage of elderly citizens will die in vehicles or on streets. The alternative requires massive investment in affordable senior housing, healthcare integration, and income support. Without these changes, the crisis will continue expanding until it touches nearly every family in America. The question isn't whether this crisis will worsen, but whether society chooses to intervene before the death toll becomes undeniable. This is what a system looks like when it lets its elders disappear. And this crisis doesn't stop here, because in our next video, we expose which states are accelerating senior RV evictions right now. Watch it next and tell us in the comments, should this be happening in America at all?